So today we're going to talk a little bit about shoulders, shoulder pain, rotator cuff. We're going to mention how it relates to baseball, but how it is important for everyone to understand a little bit more about how the shoulder works. Hey, I'm Dr. Ekberg with Wellness for Life, and if you'd like to truly master health by understanding how the body really works, make sure that you subscribe and hit that notification bell so that you don't miss anything. When we have new patients, we test all the muscles in the rotator cuff through applied kinesiology. We isolate them and we muscle test them. And the single most common muscle in the body to be compromised is called the infraspinatus. And that's a muscle in the back of your shoulder blade that is an external rotator. So if you hold your arm up like this and you lift the hand, that's called external rotation. And it is the infraspinatus muscle that does that motion. So while it does affect a tremendous number of baseball players, it is extremely common in any sort of throwing or any sort of pitching motion, such as football, baseball, tennis, anything overhand. And what happens is that once you throw a ball, then there's force as you throw it, but then once you release, now that arm keeps on going and something has to slow it down so that it won't fall out of socket. And that muscle that slows it down is the external rotator. That infraspinatus muscle is what slows down this motion. And if it has to do it over and over and over and over, you can create little micro trauma, and over time you can develop some trigger points, and you can distort the feedback to the brain so that the brain isn't quite up to speed with how to do that with the most precise control possible. One way you can test this, and I would estimate that in people who play tennis or baseball or do some sort of pitching motion, I would say that probably 70 to 80% of people would have an inhibited, a non-locking infraspinatus. So if you want to test it, then you put one hand underneath their elbow, you put one hand on top of the wrist, and you push and you rotate the hand, the arm, the forearm this way. It should give a very precise and firm lock. If it does that, it is working. If it doesn't, then it's not. And it hasn't got a lot to do with strength, because someone can be incredibly strong and offer a lot of resistance, but it shouldn't give at all. And you can also check around the shoulder blade, on the lower half of the shoulder blade, if you push and there's a lot of sensitive trigger points, especially points that send sensations into the arm or the hand, then you know that there's a problem there. And it's the single most common problem that we find with the shoulder, whether people play baseball or do any pitching or not. So some of the things that you could do for yourself, and you want to be a little careful, is you can lay down on your back on the floor and you put a tennis ball behind those tender trigger points and you roll around on the floor and you kind of massage yourself. So be careful though, because it's tempting to do a whole lot all at once, and you might be sorry because you get really, really sore if you overdo it. So start it real carefully and see how that works. Your best option would be to find a chiropractor who does applied kinesiology, who can evaluate this and who knows how to test it, how to adjust it, and what the associated organ reflex points are, because everything in the body is connected, and if we know what it connects to on an information level, then we can get the problem resolved at a deeper level. So understand that injuries don't really happen without something being out of balance first. Sure, if you fall down the stairs, if you get hit by something forceful, you can create an injury. But overuse injuries don't develop, or repetitive use injuries, I should say, don't develop unless there is already an imbalance. And if we can address that imbalance beforehand and get the brain perfectly tuned with the rest of the body, then those injuries are much less likely to occur. So I hope this information was useful. If you have any experiences with this, then don't hesitate to leave some comments. Let me know what's been going on in your case. If you have questions, I'll do my very best to answer those as well. If you enjoy this sort of content, if you want to learn more about the body and how it works behind the scenes, then make sure that you subscribe and hit that notification bell so that we can keep this content coming your way and you don't miss anything. Thank you so much for watching.